Welcome to Toledo Clinic TV. My guest is Joe Gall. He's a pharmacy student and he's here today to talk to us about nutrition education. Welcome. It used to be that we all focused on the food pyramid when we made the choices about what kinds of foods we were going to eat, but that is no longer the case.
That's right. Everyone learned about the food pyramid back when they were in school. If you remember, it had our basic building blocks at the bottom, our grains, things like that, and at the top it had things we didn't want to eat, things like sugars and unhealthy fats. But the pyramid is actually obsolete. It's not used anymore. Right now there's a much more simpler method that patients can more easily relate to called the plate method. So I'm going to go over this plate method here for you. So basically, we section off this plate into a variety of different sections to cover all our food groups. This is supposed to be a 9-inch dinner plate, and half of our plate here is dedicated to our low-carb vegetables or non-starchy vegetables, things like broccoli, cauliflower, garden salad, asparagus, peppers, vegetables like that. And then a quarter of your plate would be dedicated to a protein serving. This could be meat such as chicken, fish, beef, pork, or as well as other sources of protein such as tofu, peanut butter, or eggs or cheese. And then our last quarter on our plate here is for our starchy foods. So this could come from starchy vegetables like peas, corn, or potatoes, or it could come from grains, such as a piece of bread, pasta, or rice. And then off to the side of our plate, we have a serving for dairy. So this could come from an 8-ounce serving of low-fat milk or an 8-ounce serving of low-fat yogurt. And then there's a serving of fruit as well, which should be about the size of a baseball serving of fresh fruit. And patients really seem to like this method a lot more. It's very simple. What this does is it helps to lower the amount of carbs and calories we take because half of the plate is dedicated to your low-carb vegetables. And it also helps you get your servings of protein, fiber, and healthy fats. These can actually help you feel more full after a meal. And they can also reduce glucose spikes after a meal, which is especially important for people battling prediabetes and diabetes on top of trying to lose weight.
So all of this can be very confusing, but you offer these education services to patients, things about nutrition, and then also you mentioned the diabetes. What kind of services can people take advantage of?
That's right. So I've been working with the Toledo Clinic Health Education Center this month, and we offer a variety of services. We do have a licensed dietitian on staff who offers many different nutrition services. So a patient's nutrition, it depends on who they are, what kind of diseases they have. So we have specialized programs for patients with cancer, hypertension, cardiovascular disease, diabetes, gout, a large variety. We also offer an accredited diabetes and prediabetes education program, which we really get to know our patients over time and help them to give them the skills and knowledge that they need to better manage their disease. And they actually have done studies on the diabetes education programs where they took patients who weren't enrolled in any classes and then compare them to patients who were enrolled, and it was actually proven to lower glucose levels, and patients were much more confident in managing their diabetes.
And in perhaps many cases even avoid some medications and other complications that come along with those diseases.
That's right, definitely, and we do get into what can happen down the line in diabetes, and that's why we really focus to get patients to manage it as best as they can.
Okay, good. That's very important information. Thank you so much.
Thank you.
All right, we'll be back in just a moment.